Last week on the show, we told you about a study that said men have a harder time when it comes to getting sick. Basically, it said they're bigger babies than women. We're going to see if this is true. So what's the best way to deal with this and how to get a guy to go to the doctor? Where Dr. Alexander Chester is here from Foxhall Internists with the 5 tests that every man should have to stay healthy. Doctor, welcome. Before we get to these 5 big ones, level with me here. Why is it that guys are just either scared, women think, or just avoid the doctor?
Well, I think it's genetic. Just the same reason they don't ask for directions. They're programmed to be tough and self-reliant, which works great in the workplace, but isn't so great in the health department.
So you're saying it's all connected?
Right.
No,
right.
Don't want to ask to get help, don't want to get help. I've also heard that maybe they just don't want to get the bad news if something's wrong. Oh,
there's always denial, and there's always embarrassment, things like that. That prevents people from going to the doctor as well. But I think it's a little bit more just the way they're hardwired. And the women are paid enormous importance in terms of getting them to the doctor. They say that over half of appointments are actually initiated by women and made by women for men.
Because we're the nags.
I wouldn't put it quite that way. Concerned and loving was the way I'd phrase it.
Nicer way. I like that. I like that. Let's go over some of these tests and why they're so important. I think, we're making fun of the guys, but some women are like this too. If nothing's wrong with me, if I feel fine, why do I really need to go to the doctor? We're concentrating on men today. The first one is the testicular exam. This is very important. Why? Right.
Well, it's important for younger men more than older men, actually. Probably up until the age of 35 it's more important. But it's a good, the testicular cancer is an extremely treatable cancer. So it's a good idea to get a testicular exam and follow that. Now, see, women, you mentioned women a moment ago, they get used to it. They get used to going to the gynecologist, get tuned into it from an early age. So it's much more sort of in their realm.
What age groups are we talking about for this exam?
15 to 35.
15 to 35.
Yeah.
After that, how often?
With a regular annual checkup. A person should see a doctor once a year. Maybe not for everything, all of the tests, but just to check in once a year. Okay. The doctor can look over all of those items.
Number 2 on this list, also still very important, a blood pressure check.
Right. There are millions of men with high blood pressure that just don't get it checked. It's easy to treat. Checking it makes an enormous difference. We know that taking blood pressure medicine and continuing it really reduces mortality rate, reduces stroke dramatically, reduces heart attacks. So it's a real winner. And the medicines these days, people are often worried about taking medicines because they think they're going to have bad side effects. Most of them don't now. The medicines are extremely good. You wouldn't know you're taking them, mostly.
Who should be more concerned with blood pressure? Someone that's overweight, someone with a high-stress job? What would you say?
Right. Definitely overweight. Overweight's a big factor. Salt, they've started to address this in New York City, particularly the salt intake. People in America have a lot of salt, and if you're a salt-sensitive person, that would raise your blood pressure. So when you think of a man who's well overweight and having chips for lunch and that kind of thing, that raises the blood pressure, and a person should get checked, modify the health habits, and take medicine if need be.
We all love our potato chips.
Right.
Next up, cholesterol test. Now this could also, some people are just born this way with genetics that it leans toward high cholesterol.
Exactly. Exactly. But there's a lot you can do about it. And some people's diet is very high in cholesterol. But that's another example of a medicine that is you wouldn't know you were taking, and it reduces the risk enormously. Stroke and heart attack. But many people aren't aware of what foods have high cholesterol in them, and if they were, and they talk with the dietitian, a little bit with the doctor, they could modify their diet and reduce it substantially.
So if my mom or dad or both had a problem with this, then I should, at what age, if I know they're taking stuff for cholesterol or they've been advised by a doctor to say cut back a little bit just to be on the safe side, when should that person, if they had it run in their family, when should they be coming in and getting tested?
The recommendation is to start at age 21. Many people feel it's important to start earlier, at least in terms of dietary counseling. I mean, the health problems for the United States are become enormously increased with the obesity and with the diet. So you really can't start too early with cholesterol. But in terms of an internist's point of view, it should be checked, and it can be checked much more often in a person who has a problem than someone who doesn't. So check it for an internist. I check it at age 21, and then depending how high it is, check it at intervals after that.
Okay, just keep on getting checked.
Yeah, it depends what the level is about how often you need to get checked.
Okay, I think number 4 on our list. Nobody wants to do this one, but they have to. A colorectal exam.
Right.
I mean, colon cancer, we've heard about it. Sometimes people, are diagnosed with that, and they haven't been checked because they don't think there's a problem. But sometimes it's already full-fledged. This is very important.
It's very important. It's second or third leading cause of cancer deaths. It's preventable. Probably 90% of it's preventable by those screening colorectal exams. They're not as bad as they sound. In fact, people do not complain of the actual test.
I think people just get a little sensitive, like, oh, what are we talking about here, It
doesn't sound too good, that's granted. But most people don't like the prep of the test. They don't complain about. And they get a good feeling. Afterwards, you know that inside everything is okay. It's very reassuring.
It's good to know.
Yeah, you can just sort of write that one off the list in terms of a risk factor.
How often on that one?
It depends upon the risk factors. If a person has colitis, it has to be more often, or a family history, it has to be more often. But usually every 5, and in some cases 10 years is sufficient.
Okay.
So it doesn't take too many in the course of a lifetime to protect yourself.
Right. It's just being on top of it.
Right.
Staying on top of it. What is a PSA?
That's a prostate-specific antigen. It's a test for prostate disease. An elevated level doesn't necessarily mean cancer, but it's a sign that it has to be checked out more. That should start at age 50 annually for men, along with the prostate exam, and earlier if there's a family history or in certain groups. But it's very sensitive for picking up prostate cancer, and because of it, the deaths from prostate cancer are going down.
That's good to hear.
So it's successful, yeah.
Is it something, you said men 50 and older should be getting that yearly? Is it
Yes.
something most insurances cover around that age?
Many of them do.
Experience?
Yeah, and the government, Medicare now covers it. It's covered it for several years as a preventive test that's worthwhile.
Okay.
So,
All good
yeah,
advice.
yeah.
Dr. Chester, thanks for being here.
My pleasure.
Trying to get
Thank
those
you.
guys to go see the doctor. We're trying, right? Good to meet you.
Nice to meet you.